So we're going to be covering the mini lab checkoffs for number 5 and number 6 today. So I'm going to start with washing my hands. And good morning. My name is Ginger. I'm going to be your nurse today. Can you please tell me your name and date of birth?
Sure, it's Lauren Everly, 11/23/19XX.
Excellent. I'm going to just pull this curtain for some privacy. And today, Miss Lauren, I'm here to do an assessment of your thorax, lungs, heart, and neck vessels.
Okay.
Do you have any questions? All right. Let me give you this gown so you can put that on. And my first question is just, do you have any overall pain that I should be aware of? Okay. Now, more specifically, do you have any cough? And do you have any shortness of breath? Do you smoke?
Nope.
And do you have any chest pain?
No.
All right, great. So first thing I'm going to do is take an assessment of your back of your.
Okay.
So if you could, for the video's sake, swing around. All right. So as I'm moving from your front to your back, I'm looking to see that her AP diameter is a 1:2 ratio to her transverse. So that is a normal finding. She doesn't have any abnormalities with her AP 1:2 ratio. So the next thing I'm going to do is inspect her back overall. I don't see any accessory muscle use with her trapezius. I see that her position is erect. She is able to hold her posture upright without difficulty. Her spine is midline. So after that, what I want to make sure that I'm doing is looking at accessory muscle uses. It's pretty good. Okay, so what I'm going to do is palpate for any pain or tenderness. So you tell me if you feel any pain or tenderness.
Nope.
Good?
Mm-hmm.
All right, so now I'm going to percuss. And I'm going to percuss in 12 locations, 6 levels of your lung fields. Can you lift your arms up? Perfect. 8. Think about where I'm going, sorry. All right, sounds good. And now I'm going to listen with my stethoscope using the diaphragm. So when I place my stethoscope, if you could take a full deep breath in and out. Now, after demonstrating 4 full breaths, I'm going to continue to demonstrate the additional 8 spots, but without having the patient or our demo perform that. I don't want them to get lightheaded during this, but in reality, you would have them continue to do the deep breaths. So we are now at 5, 6, 7, 8, 9, 10, 11, 12. As long as you're doing a ladder pattern and comparing, that's going to be fine. So that should be it for the back. If you want to swing around to the front. Nope, it is not. All right, so now coming back to the front. So I'm going to start with looking at your lips and your color is nice and pink. Can I see your nail beds? I just want to take a look quickly at your, you have nails gels on. So I'm just going to say that they are pink. There's no any cyanosis that's visible on that. So looking at your respiratory rate, it does not appear to be bradypneic or tachypneic. I'm not going to recount it at this point. Your rhythm is, your pattern is a regular rhythm, so there isn't any abnormality there. Your depth is a normal depth. You're not labored at all with your breathing. Your chest rise is symmetrical, and you're not using accessory muscle use of the sternocleidomastoid muscle when you are breathing. So that all looks excellent. Wonderful. So now I'm going to just palpate the anterior portion of your chest. Are you okay if I touch your chest? Okay. So this is just in general, any pain or tenderness? No pain or tenderness in there as well? Okay, excellent. And then I'm just going to auscultate. Again, I'm going to do 12 spots. Just take a deep breath in and out. You just breathe regular for the rest. So this is then 5, 6. Can you lift your breast up? 7, 8, and then keep your arms up. 9, 10, 11, 12. And both posterior and anterior, all of your lung sounds are vesicular. I don't hear anything. And any abnormalities. And your percussion tone was resonant, which I did not mention. So all of those look good. All right. All right, so let's move on to your neck and heart assessment. So with your neck, I'm just going to palpate your carotids. So you have a good 2+ regular rhythm, and you have good elasticity with a nice broad upstroke. You have a 1+ on your right side, but the rest of the components are the same, but it is a little weaker on your right side as I'm pushing you off the bed. All right, so now I'm going to listen to your carotid arteries using the bell side of my stethoscope. I'm going to give you some instructions. Okay, so if you could take a deep breath in, let it all the way out, and then hold your breath on the out. Okay, go ahead and do that. In, out, hold, and I'm going to listen. 1, 2, 3 locations. I do not hear any bruits on her right side. I'm going to do it again. Go ahead and breathe. And I don't hear any bruits on your left carotid either. So that's all good. I'm going to have you go ahead and lie down. If I can get it. There it is. Can you turn your head to the left, please? So I am looking for jugular venous distension. I do not see any. If I did see any, I would ask the patient to sit up to 45 degrees. We would assist them to that. Do an additional assessment with a head turned towards the left. I again continue not to see anything, which is a normal finding, and then have her sit up to the 90 degrees. If it was present, it is not. I do not need to notify the provider that there's an abnormality of jugular venous distension. So going now to the heart. I'm going to re-ask those 4 questions because they're a part of the heart assessment. So my first question is, do you currently have a cough? Nope. Do you have any shortness of breath? Nope. Do you smoke? Nope. And do you have any chest pain? Nope. Wonderful. So looking at inspection, when I'm looking at your anterior chest, this time I'm specifically looking to see if you have any heaves, lifts, or any pulsations that I can see across your chest. I do not see any abnormalities with your inspection. Now I'm going to go ahead and I'm going to palpate your apical pulse. So your apical pulse is on your left side. It should be in the 5th intercostal space, midclavicular line. And let's say it's a 1 centimeter in width. It's a nice tapping, brisk, 2+, and it's regular. Great. So now I'm going to listen. Now that I've palpated, I'm not going to percuss. I'm going to go straight to auscultation. And I'm going to ask my proctor to come over and do a heart rate assessment with me. So I'm going to be listening with my diaphragm of my stethoscope over the apical pulse. And my proctor, when they come over, is going to take a radial pulse at the same time. So we won't be using the double-headed stethoscope, and we're not going to be using anything else except you're going to be doing the auscultation piece, and they will be doing it through radial. but it's the same process as what we did in vital signs. So I'm going to place this, I'm going to listen. Okay, so I have it, and I would say to my proctor when I'm ready, 3, 2, 1, 0. All right, so you get the idea. It'd be a full minute, and then you would report. They're about 75 right now. Okay, so now that we have completed that, I'm going to continue my auscultation of the 5 areas of the heart. I'm going to start with my diaphragm. I'm going to use my landmarks. I have to announce my landmarks to my preceptor as I'm doing them. And so I'm going to verbally say where I'm putting it. I'm going to actually name the area that I am auscultating, and I'm going to perform it at the same time. So I'm going to do second intercostal space, right sternal border is the aortic area. Second intercostal space, left sternal border is pulmonic. Third intercostal space, left sternal border is Erb's point. Now tricuspid, just because of our model's clothing, is tricuspid is at the 4th intercostal space, left sternal border. And then mitral is where we just were. The mitral area is right here. So we do mitral in the 5th intercostal space, midclavicular line. Now, after I have demonstrated, I just want to verbalize to the preceptor that I heard what is considered normal heart sounds. So you have an S1, S2. Your S2 sound was greater or louder than your S1 sound in aortic and pulmonic. They were equal in intensity at Erb's point, and then your S1 is louder than S2 at tricuspid and mitral. So now I'm going to listen a second time with the bell, and now this time with the bell, same exact areas. I do not this time need to tell you the location or the name. I simply have to perform the 5 areas. And with the bell side, I'm specifically listening to see if there are any clicks, gallops, rubs, and I do not hear any clicks, gallops, rubs, or murmurs. Okay, excellent. Do you have any questions? All right, so I did not find any abnormalities, and I'm going to wash my hands. We discussed it. I have nothing to report to the provider, and I'm going to document my findings.